Hello and welcome to this press conference on COVID-19. I am your host, Fernel Neptune. Today on the panel, we have the Chief Medical Officer, Dr. Sharon Belmar-George, the National Epidemiologist, Dr. Michel Fassoir, and the Principal Nursing Officer, Julieta Cassius. This broadcast is being streamed live via the National Television Network, the Government of St. Lucia's YouTube channel, and also the Facebook page. First, we will have presentations from the panelists, and then we'll take a few questions from the media. First, I will call on Dr. Michel Fassoir, who will provide us with a COVID-19 situation update. Thank you.
Thank you very much, Ms. Neptune, and a pleasant good morning to all St. Lucians out there. I will start with a global update of the COVID-19 situation. As of the 27th of February, 2022, over 433 million confirmed cases have been reported, with just over 5.9 million deaths. There has been a 16% decrease in cases and a 10% decrease in deaths compared to the previous week. And the region of the Americas reported a 30% decrease in incident over the previous week. Regionally, similar trends were noted, and the highest 7-day average was noted on the 15th of January 2022, and the numbers continue to decline within the region. Locally, we have documented 22,712 confirmed cases of COVID-19. Our indicators have continued to go down as we continue to monitor them. Our daily infection rate has moved from 19.4 to 9.1 over a period of 1 week, over a period of 7 days. Likewise, we noted that our testing positivity rate is at 20%, and that is as of the 14th of February. Our public health monitoring indicators also continue to show promise. Our rate of hospitalizations are down from January 11th, from 34 to the 1st of March at 18. We needed to be at under 50, so we have achieved that target. Also, our daily infection rate as of January was 116.6 per 100,000, and we are currently at 9.1 as of the 1st of March. Our target was under 10, so again, we have met that target. Our RT in January was at 3.3, and we are currently at 1.1, with our target being under 1. Our test positivity rate in January was 36, and we are currently at 20. Our target is under 5, and so I expect, with the current trends that we are seeing, that this test positivity will continue to decline as well. Our active cases in January stood at 1,671, and as of the 1st of March, we are currently at 102 active cases. We needed to be, our target was under 100. So that target, we are almost there as well. In terms of our epidemiological curve, we continue to see a sharp decrease in the number of cases, and we are trending very nicely. Our peak, we have passed our peak, and we continue to decline. We note our numbers are decreasing. We note our numbers of persons at the respiratory clinics are decreasing as well. So we are noting that we are at the end of our wave, and however, we continue to appeal to the public to adhere to the public health measures and do the necessary to maintain this decline in the number of cases that we are seeing in St. Lucia. Thank you.
Thank you very much, Dr. Fassoir. I now turn to the Chief Medical Officer, Dr. Sharon Belmar-George, who will be providing us with an update, and she'll also be speaking on living with COVID-19 and also the strengthening of public health measures and how we'll be integrating the COVID-19 response into the health system.
Thank you very much, Ms. Neptune. Good morning to all. This year, 2022, marks the 3rd year of the management of COVID-19 in country. St. Lucia has managed 5 waves in country, with 22,712 cases diagnosed and about 358 COVID-related deaths and COVID deaths, with presently 102 active cases presently. As indicated by Dr. Fassoir, we have managed the 5th wave, and we are now within our threshold numbers in countries, with our public health indicators being at normal rate. At this phase of the pandemic, We have had extensive community transmission, and the full country reopening, it requires a different strategy as we learn to live safely with COVID. We have acquired the knowledge of the virus and country-specific data to guide the required actions to reduce transmission, manage the outbreaks, and keep us safe. We have also developed the capacity in country for prevention with the availability of safe and effective vaccines, surveillance, testing capacity, quarantine and isolation, treatment and care. As we move towards living safely with COVID-19, the Ministry of Health, Wellness and Elderly Affairs has integrated the aspects of the COVID-19 response into the general functions of the existing system. This will facilitate the strengthening of the other public health and primary care programs which have been reduced due to our management of the COVID-19 pandemic. These adjustments allow our health resources to support and strengthen our programs such as that for chronic care as diabetes and high blood pressure, antenatal care, sexual and reproductive health, just to name a few. So today we'll discuss the changes that have been made to isolation, quarantine, testing protocols, contact tracing, home monitoring, vaccination sites and respiratory clinic locations. Our communication and information strategy will also be amended. As most other services have already been restored to normal operations, it is important that all organizations, both public and private sector, continue to ensure the strengthening of all of the public health protocols. We continue working with various sectors to reduce restrictive protocols without increasing the health risks. The idea of living with COVID-19 also means that we keep our services functioning even during the management of waves, utilizing targeted interventions at the main areas of risks. COVID-19 has led to severe loss of productivity. Moving forward, we propose keeping our sectors open as we enforce the measures we know that can work. We ask for the full cooperation of the public and personal responsibility as together we return to normalcy in a safe way. Thank you.
Thank you very much, Dr. Belma. As we move along in the discussion, we now going to have a discussion on isolation and quarantine protocols and also the testing protocols. And one that is probably new also is the contact tracing protocol. So I now call on Dr. Bishop Faswa to speak on that area.
Thank you. As indicated by the CMO, particularly during this last wave, there was a need to revisit what we did in order to create a safe balance between productivity and our public health functions. To this end, a decision was made to adjust our isolation and quarantine policy. So for vaccinated individuals who have tested positive for COVID-19 and have no signs and symptoms, isolation would be ended after 7 days. However, masks should be worn at all times and around others in public. If symptoms do develop after testing positive, the isolation period would start over, with day 0 being the first day of symptoms, and the full 10 days of isolation must be completed. For unvaccinated individuals who have tested positive and have no symptoms, they would have to do the 10 days of isolation, continue wearing the mask around others and in public, and similar to the vaccinated persons, if symptoms develop after testing, then they need to restart their isolation period, with day 0 being the first day, and complete a full 10 days of isolation. For individuals who are symptomatic, who present with signs and symptoms, regardless of vaccination status. So once you're symptomatic, whether you're vaccinated or not, The 10-day isolation period remains, and persons need to complete their full 10 days, and during that, the last 3 days need to show significant improvement in the clinical status or be asymptomatic. So for days 8, 9, and 10, they need to see some sort of improvement in their clinical status or remain asymptomatic. For individuals who have tested negative, so these are for individuals who have been exposed and have been placed in quarantine. Quarantine is reduced. Once you have no symptoms, you can end quarantine after receiving a negative test taken at day 7 from the last day of contact with an individual, and continue monitoring for signs and symptoms for the full 14 days. So if you have been in contact with an individual who is a confirmed case, you should be placed in quarantine and tested on day 7. Day 7 after your last contact with an individual. Not immediately, because it is possible that the viral load is too low and the test may not be able to detect it, and you may have a false negative, in which case you would need to retest. So in terms of contact tracing, similar changes have been made. When we look at contact tracing and we look at the intensity in terms of financial, HR, and time, there is a need always to evaluate what we are doing and why we are doing it. And as the pandemic or an epidemic progresses, there is a need to adjust our response, likewise contact tracing. As we do have documented community transmission, there was a need to revisit what we did in order to make it as effective as possible. We saw during this last wave, there were difficulties in reaching individuals with their test results, persons who had tested positive, because of the magnitude of cases that we would get on a daily basis. There were days when we would record at least 500 cases, and it made communication with positive cases quite difficult. So based on this, we decided to revisit what we did. And the goal was to ensure the timely communication of positive results to confirmed cases in order to facilitate the early notification of their close contacts, of their exposure, and the consequent reduction in community transmission. So for individuals who had tested at the respiratory clinics throughout the island, once we receive the positive results, these individuals would be assigned a contact tracer from the Ministry of Health and Wellness, and they would be contacted via telephone and informed of their results. Persons who were tested at the respiratory hospital would receive the results from that institution. So either by email or telephone, they would receive their results. Travelers would be issued their results via email from the Ezra Long Lab. And for persons who tested at a private physician, the results would be sent to that physician, and communication would be established with the individual to communicate their results. Persons who got tested at a private lab, who did a PCR at a private lab, if they were walk-in, for example, an individual who came in because they realized that they were in contact with a confirmed case, or because they presented signs and symptoms of COVID-19, they would be assigned a contact tracer. For individuals who went into a private lab but went in with a lab request from a private physician, the results would be sent to that private physician, and the results would be communicated by that individual. For guests and visitors, the medical staff on duty at the various hotels and other accommodation sites would inform the respective guests of their results. We felt it necessary to involve our stakeholders who actually reached out to us in support of this, to ensure that persons got their results on time, and for that we are very grateful. So moving forward, we continue with this format in terms of dissemination of results to confirmed cases of COVID-19. In all cases, the confirmed case will now be responsible for informing his or her close contacts of the exposure within the 24 hours and of the need for them to get tested on the 7th day. Now, this is a bit different to what was done previously. Prior to this, the contact tracers would be the one to notify all contacts. As we move to sustainability, as we move to living with COVID, we're asking persons to play their part in informing their close contacts, The Ministry of Health continues to provide guidance through our Bureau of Health Education on what a close contact is and how do you define that individual. There are several parameters that need to be taken into consideration. And with that, I thank you for your attention.
Thank you very much, Dr. Faswa, for providing us with that information on the different protocols which has been revisited. Thank you. As we look to live with COVID, and right now we have just passed the 5th wave, it is important that we get to some level of normalcy. And with that, we are going to be seeing some changes with the vaccination sites and also the respiratory clinic when it comes to location and also the restructuring of the health system. So I now call on the Principal Nursing Officer, Julieta Cassius, to speak on that.
Thank you, Ms. Neptune, and good day to all. So as we've heard from Dr. Belma and Dr. Faswa, and we are aware that there has been a significant reduction in the number of cases, and we are at the end of our 5th wave. So we felt right now we needed to be able to respond to COVID-19, integrating all of our healthcare services into our wellness centers. So what we want to do right now is a bit of restructuring. So our essential healthcare services have been provided to some of our wellness centers in a limited amount. So what we want to do is to be able to expand that and to go to our pre-pandemic state. So all of our wellness centers will resume all of our critical, essential primary care services. Our chronic disease clients, we have our maternal and child health clients, we have our clients who have been out there within the homes and have kind of limited visits. So we want to re-establish all of that. We have had significant health gains over the past years, and we really would not want to be able to lose any of that. So we really want to re-establish all of our health care services at all of our wellness centers. So what we will be doing is to be able to ensure that persons with appointments, because we really want to be able to maintain the appointment system. We've developed all of our COVID-19 protocols, the public health measures that have been put in place. So we really want not to take that away. So we would need to be cognizant, like you said, living with COVID. So we still need to be able to maintain those protocols to be able to deliver healthcare in a safe manner. So in terms of the appointment system, we would really want persons to be able to keep their appointment as given by the healthcare provider. And of course, if they're not able to meet the appointment, or at least call to be able to reschedule. What that is going to do is to help reduce any overcrowding at the wellness centers, and also, most importantly, the client will have a reduced waiting time at the facilities. We know our wellness centers are not extremely spacious, particularly the waiting areas, so that is really going to alleviate any or reduce any overcrowding at the facilities. The other thing that we want to do is to also to better utilize our wellness centers. The operations of the wellness centers are from 8 to 4:30 p.m. So we want to encourage persons we know the medical clinic might be the most challenging, but the district medical officer is there throughout the day, the nurse is there throughout the day. So we really want persons, not all to be crowding the facility on a morning, but on afternoons to be able to better utilize the space at the facility. And like I said, we really reduce waiting time and to be able to provide or receive care in a comfortable environment. In terms of the respiratory clinics, we had established 5 respiratory clinics on island, Soufrière Hospital, Denry Hospital, the Bluefort Wellness Center, the Grosile Polyclinic, and the Leclerc Wellness Center. For Soufrière and Denry Hospital, we were able to continue providing our other primary healthcare services. And so we had established the respiratory clinic separate to be able to serve the public. So that will continue. For Grosile Polyclinic, we know that we had taken up the entire primary care section to be able to deliver the respiratory clinic services. What we want to do is to be able to identify or to reassign a space that we can continue providing the respiratory clinic services, and to re-establish our primary care services. We know that the residents of Grosley have had to relocate, visit other wellness centers in the surroundings, and so we really would want to re-establish that clinic at the soonest. For the Rupert Wellness Center, again, we were able to establish a separate space, so that will continue, and our primary healthcare services will continue at full scale. And for Denry as well, to be able to identify additional space so we can reclaim our primary care section to be able to re-establish our primary care services. The only exception will be that of Leclerc, because we had used up the entire facility to provide respiratory services. So what we will do is to be able to relocate the respiratory clinic services from Leclerc to the annex at the Victoria Hospital. So we will not be eliminating altogether respiratory services for the Castries Basin. So these services will be relocated to the annex at the Victoria Hospital. We will send a notification when that takes effect. Hopefully we can do so within the next couple of days. We do have a little bit of retrofitting to be done in that annex. And so we are hoping that we will get this done within the next couple of days so we can resume. But in the meantime, respiratory clinic services do continue at the Leclerc Wellness Center. And as I indicated, we will be able to send a notification when that takes effect. However, I also want to encourage the residents of Leclerc to be on the lookout when we do establish all of our primary care services, our maternal health, our child health, diabetes and hypertensive, our screening. So we will resume full-scale services at the Leclerc Wellness Center in the coming days. As it relates to vaccination, currently we at 58,000 persons have been vaccinated, whether with the first dose or with second or booster doses, which makes up for 28.7%. So we all know we are nowhere near what is expected of us as a country, and to be able to provide the population immunity that we need. When we started vaccination, COVID-19 vaccines in February of 2020, we did have we were giving mass vaccination. So we had the vaccination sites throughout the island where we would offer vaccinations to the public. And of course, that was extremely important because we wanted to vaccinate as many people as possible within a short space of time to be able to reduce transmission, reduce severe disease, reduce hospitalizations. And so it was important for us to be able to provide vaccinations in that manner. However, as we integrate, what we will also do is to be able to integrate the COVID-19 vaccine into our routine vaccination program at the wellness centers. So effective 1st of March, you would have been made aware that those sites no longer exist, and so persons would need to visit the wellness centers in their community or a wellness center of their choice to be able to receive the COVID-19 vaccines. So in a way, we are making the vaccines a bit more accessible because you can present at your wellness center to receive your vaccine. A schedule has been published, and we will continue publishing that schedule so persons are made aware as to on what day the vaccines will be made available in the community. So we still want to encourage everyone out there who have not been vaccinated and you are eligible to get the vaccine to please do so. Call the wellness center or visit the wellness center so you know what day you can present for your COVID-19 vaccine. Vaccines still remain an essential public health measure and cost effective at that in reducing the burden of disease on the population. So I really want to encourage all of us to continue getting ourselves vaccinated, getting our loved one vaccinated, to be able to reduce any impact or any surge in COVID-19 virus. Thank you.
Thank you very much, Ms. Cassius. Before we move to the section of questions from the media, just a few things I wanted to point out. Key messages. We note the change for contact tracing, the protocol where persons now have to play their part, where if you have tested positive, it will be your responsibility to contact your persons to let them know based on the level of exposure of whether or not they should go and get tested. Also, to note that on effective March 1st, that vaccination sites will no longer be at the advertised vaccination sites. However, persons can visit the wellness center based on the schedule, which is posted on the Ministry of Health Facebook page and also the Bureau of Health Education Facebook page. Also, in the coming, in a few days, we will be giving information as the Leclerc Wellness Center respiratory clinic will be moving to the annex at the Victoria Hospital. So information on that will be provided later on. Right now, we'll take a few questions from the media. Okay. We do not have any questions from the media, so we will ask that the Chief Medical Officer give us some closing remarks.
Thank you very much, Ms. Neptune. At this phase, we have indicated some of the adjustments that we have made to live safely and to manage in an efficient way, utilizing our human health resources, and to ensure that we strengthen our primary care and our public health systems as we manage COVID like we do for other infectious diseases. So we have indicated the changes that we've made to contact tracing. We are empowering the public to inform their contacts. The changes we've made to home monitoring, to the vaccination sites and the respiratory clinics, to isolation, quarantine, and also testing. Just as our principal nursing officer has indicated, we advise the public to get vaccinated for those who have not. We are also encouraging the public to apply for the electronic vaccine passport, as very soon we will be phasing off the use of the card. So we are asking persons as well at the soonest to apply for the electronic card. I just want to appeal to the public as we move into this phase of managing COVID in country. We appeal to you for your cooperation and for you to continue working with us so that we can keep our numbers low as we live and work and try to manage and get back to some form of normalcy in the future. Thank you.
Thank you very much, Dr. Sharon Belma George. We have a question from the member of the media. Well,
good morning. Can you hear me?
Yes, we can.
Okay, good morning, panelists. Onika McCoy, Choice TV. My question, I just wanted to get the Ministry of Health stance or views on self-testing and results from self-testing kits being accepted for entry into St. Lucia. Thank you.
We do not accept self-tests for entry into country.
Is that it? Any more questions? Thank you very much, Ms. Onika McCoy. Okay. At this time, we have no more questions from the media. So, of course, I would like to thank the panel for being here and providing us with information as it relates to COVID-19 in terms of the situation right now and us living with COVID-19 and getting to some level of normalcy, and also information on the restructuring of the health system. Thank you so much. Thank you. Well, with that, we've come to the end of the press conference for today. On behalf of the entire production team at GIS NTM, I am Fernal Neptune. Thanks for watching. Until next time. more for truth.